जनाब डॉक्टर फारूक अब्दुल्ला साहब, मोहतरमा सकीना यत्तू साहिबा, डॉक्टर सैयद आबिद रशीद शाह साहब, प्रोफेसर आशुतोष गुप्ता साहब, ऑनरेबल MLA जम्मू वेस्ट जनाब अरविंद गुप्ता साहब, डॉक्टर मोहम्मद सलीम खान साहब, डॉक्टर विशाल टंडन साहब, डॉक्टर आशिमा बड़ियाल साहिबा, faculty GMC Jammu, ladies and gentlemen, I got caught a little unawares simply because in the list of speakers that I had 3 people who had to speak before me. So I was still sitting and collecting my thoughts when suddenly my name was sprung, and here I am. So just bear with me as I figure out how this brief intervention of mine is going to go. I was trying to figure out why I was here, because almost everyone else, not almost, everyone else, barring the Honorable MLA Sahab, he's our local host, everyone else on the dais has a connection with medicine. Barring Sakina, who left at the very last minute against the best advice of Janab Dr. Saab and myself, we have a panel of eminent doctors on the stage. I and the Honorable MLA were the only ones who have absolutely no such, we can't lay any claim to that. During the course of Principal Saab's presentation, it gradually became more and more apparent as to why I was here. And part of that, I think, links to some of the photographs that were presented to all of you. I am now acutely aware of the fact that though I am the third generation of this office, I am also the only generation of my family that does not have a stone in GMC Jammu. My grandfather has 2, my father has 2, I have none. Now, I think there also a little bit of, how should I put it, unfairness perhaps, because you might have noticed during my previous term in office, the super speciality hospital was started. उसमें आज़ाद साहब का नाम है, फारूक साहब का वज़ीर आला था, लेकिन मेरा नाम उसमें कहीं है नहीं. अब पता नहीं उस दिन मैं कहाँ पे था जब चोरी छुपे आज़ाद साहब और फारूक साहब ने वहाँ संगे या रिबन काटा, नहीं तो शायद मेरा भी नाम वहाँ कहीं ना कहीं दर्ज हुआ होता. लेकिन चलिए कोई नहीं. अब प्रिंसिपल साहब ने in the course of his presentation has put some of the ideas for future growth for GMC Jammu. I will sit down with Sakina and with Abid, and I will make sure that at least one of those proposals goes through, so I can get my stone also in GMC Jammu, so that in future, when these sort of presentations are made, I don't feel left out. Now we come to Medicon Jammu, first of its kind in J&K, but as we have been told, first of its kind perhaps in the country, that a state or a regional medical council has thought of organizing an event like this. In itself important because it allows the best minds to come together, to share ideas, to share best practices, to share advances in research, and also to deliberate and discuss on new emerging trends one of the trends that seems to be catching on. Again, Principal Saab made a passing reference to it when he was talking about the need to have a separate center for transplants. He talked about robotic surgery, and with that he added a sentence which was almost in passing, but he said, one day AI will be doing the work of medicine. And honestly, I can't imagine a more scary prospect than completely putting my life in the hand of a machine. At the end of the day, there is something to be said for human contact. And that is where you doctors, you literally do God's work. You pull people back from the jaws of death. You give people hope where perhaps all hope is lost. You are there when people are at their most vulnerable, whether it is the patients, whether it is the patients' families. You are there to join in their happiness when they recover. Unfortunately, it's not always good news. You're also there when you have to deliver the difficult news that perhaps beyond this, humankind has not developed enough to be able to treat them. You're there when their emotions are so volatile that unfortunately you find yourselves at the receiving end of their reactions or their outbursts. And it's never an easy job. I honestly don't envy you. The fact that all your lives, pretty much you're learning. I've seen that from my father. As doctors, you never stop learning. You're always learning about new techniques, new ideas, new medicines, new ways to treat patients. And therein again, as I said, this whole move towards artificial intelligence. How can a machine replace for me the human emotion that comes from a doctor telling me what my diagnosis is, or what my prognosis is, or how my family member will do? I've had occasion, both for myself or for members of the family, to have to go to hospital. And truly, we hold on to every single word that doctors tell us, every single little bit of hope. And so, like I said, Medicon 2025 in J&K will talk about a whole lot of things, but I also hope that some of the more futuristic advances that Principal Saab alluded to will also form part of our discussions. How much technology is a good thing? How much human contact can be replaced with technology? I'm sure there are many things that machines do better, but there are some things that human beings will always do better than machines. So where does one draw the line in terms of ethics in medicine? Is there ever a point where too much ethic is a bad thing? Now, these are sort of wide-ranging discussions, but they're discussions that need to be had. This whole move towards profit a means of profit. These are ethical questions that doctors always face. Doctors that go into big corporate private hospitals where they're given targets not so much according to how many patients they treat, but according to how much revenue they generate for the hospital. So a patient will go in with a headache and find themselves x-rayed for their ankles simply because they have to do a certain number of tests to meet targets. So there are all sorts of debates and discussions that go around the subjects that Medicon is going to touch upon. And the good thing is that you've also involved the students with the SRDC. I understand that 11 credits are going to be given to participants in this Medicon as well. That in itself will drive greater involvement and greater enthusiasm on the part of those who have to learn. For me and for Sakina, for Abed, our challenge is to make healthcare more easily accessible. Professor Gupta pointed out the excess pressure on the emergency in GMC Jammu. That simply stems from the fact that our peripheral areas, healthcare is not to the standard that we require it to be, which is why everyone floods into cities. The only way we can remove this pressure is not by improving or adding to our infrastructure in Jammu. It's by adding and improving to our infrastructure in the peripheral areas. Now, there was a time when we only had GMC Jammu and GMC Srinagar. Now we have GMCs at the district level. Therefore, we have to augment and improve the emergency handling capability and capacity at those GMCs so that automatically pressure on GMC Jammu, or for that matter, schemes in Srinagar will get reduced. Similarly, we have to try and ensure that our doctors not simply don't practice in cities. I know it's not a popular thing for me to say, but at the end of the day, our rural areas also deserve some amount of health care, some amount of access to medicine and medical facilities. And I truly believe that it is the younger doctors who will be able to do that, because the pressures on you are less right now. And by that I mean the pressures of having a family, children's education, and things like that. So we, Sakina, Abid, myself, all of us in the government, we're constantly trying to see how we can make your lives better by making more funds available to you, by making more facilities available to you, and also by trying to give people in the rural areas access to better quality health care so that our quality of life in Jammu and Kashmir improves. The request that Professor Gupta Saab put in about age limit augmentation, it's something we did last time. I'll sit down with the Honorable Minister, with her officers, and take a look at it. I mean, it's something in the normal course is logical. Longevity is increasing. We also need more doctors. Even last time when we raised the age, it was because we found that a number of our faculties were at risk of being de-recognized because we didn't have adequate teaching staff. We found that our best teachers were retiring far too early. And now again the same thing. Because we've added so many government medical colleges at the district level, we need to have adequate number of teaching staff in the medical fraternity. So therefore, we will sit down, we'll take a look at it, and I'm sure we'll be able to find some way forward on this, but with the expectation that J&K Medicon will sit down, deliberate, and sort of make use of this opportunity. I look forward to coming back again to GMC Jammu, to being amongst all of you, perhaps at that time with my name on a stone, but I wish you all the best. Thank you all very much.